Welcome to The Explainer. Today we're pulling back the curtain on what really makes a surgery a success. And I'll give you a hint. It has less to do with what happens on the operating table and everything to do with what happens long before. So let me ask you, when you think about a successful operation, what's the first thing that pops into your head? Is it the surgeon's skilled hands? All that fancy high-tech equipment? And yeah, of course, those things are absolutely vital. But the real make-or-break moments, they often happen way before the patient even sees the inside of that room. Because the truth is, a safe, successful surgery is built on a foundation of just meticulous preparation. It's this entire unseen first act, a whole performance where a team works behind the scenes to find and fix any potential problems. And this whole process has a name: preoperative care. The best way to think about it is like a multi-layered safety net, one that's carefully woven by a whole team of people to catch anything that could go wrong. So let's take a look at how they build it, starting with the very first layer. Okay, so the foundation of this whole safety net is maybe the most basic, but also the most critical step, making absolutely 100% sure you know who the patient is, what they need, and what their unique medical story is. In this first layer, there is just zero room for error. In medicine, you'll hear this phrase all the time, but it's not just a catchy slogan, it is a non-negotiable mantra. The second a patient is admitted, their identity gets locked in with a wristband. And if they have allergies, they get a second one, bright red, so nobody can miss it. It's a really simple system, but it's the first of many, many checks designed to keep them safe. Next up, the team starts to build a complete picture of the patient's health. And look, this isn't some casual chat. It is a full-on investigation. They're digging for clues. Are they on a blood thinner that could cause a massive bleed? Are they diabetic, which means their blood sugar needs a special game plan? And maybe most importantly, what's their NPO status? That means, when was the last time they ate or drank anything? Knowing this is vital to prevent a really dangerous, life-threatening complication called aspiration. And what's so cool here is that the physical exam is about so much more than just the part of the body being operated on. The team is looking at the whole person. They're listening to the heart and lungs, checking for tiny clues in the hands or the eyes. They're connecting all the dots to get this complete, holistic picture of how ready that person is for the stress of an operation. All right, now for the next layer of our safety net. This is where the team starts to look even deeper. They use lab tests to get a data-driven story of what's happening on the inside of the patient's body, uncovering risks that are totally invisible from the outside. So this panel of tests gives them a crucial snapshot of the patient's internal world. And each of these results answers a really important question. Do they have enough red blood cells to carry oxygen? How well does their blood clot? How healthy are their vital organs like their kidneys and liver? It's all in the numbers. Now, while all of this data is important, there are certain numbers that are immediate, show-stopping red flags. These are results that act like a hard stop, a signal that the danger is so high that the surgery absolutely cannot go forward until the problem is fixed. A high potassium level, that's a big one. It can seriously mess with the heart's rhythm, which is a massive, massive risk when you're under anesthesia. So that number has to be brought down into a safe range before anyone even thinks about starting. An INR over 1.5 basically means the blood is too thin. The risk of uncontrolled bleeding during the surgery is just way too high. It is a critical safety check that has to be addressed, period. And finally, a low hemoglobin. This tells the team that the patient's blood just can't carry enough oxygen around their body. Putting someone through the stress of surgery in that state could put a huge strain on their heart and other organs. So what's really fascinating about this next layer is that it's all about the human element, right? It's about making sure the patient, their family, and every single person on the medical team are all on the exact same page, working from the same playbook. And a huge part of this is moving from passive to active communication. See, just asking, "Do you have any questions?" that doesn't really tell you if the person understood. That's why the teach-back method is so crucial. It closes the loop. It forces the patient to explain the instructions back in their own words, which proves they actually get it. This coordination also involves this carefully managed countdown to the surgery. Certain medications have to be stopped at various specific times to balance all the risks. I mean, think about it. Stopping a blood thinner like warfarin is essential to prevent bleeding, but you have to do it just right to avoid causing a dangerous blood clot. It is a really delicate and precise balancing act. And that brings us to the final layer of our safety net.
These are the meticulous, hands-on, last-minute checks that happen in the hours and even minutes right before the patient is wheeled into the operating room. This is the final countdown.
At this point, absolutely nothing is left to chance. The surgical site is marked on the skin, and then the patient, while they are still awake and alert, confirms, yes, that is the spot. Nail polish comes off so the team can see the true color of the nail beds to monitor oxygen levels. The IV line is double-checked to make sure it's working perfectly. Even a simple sign on the door acts as a final, clear reminder to everyone. Do not give this patient food or drink. Every single tiny detail is a deliberate move for safety. And what ties this entire safety net together? It's this one guiding principle. This is an axiom that is drilled into every single healthcare professional. Every check, every conversation, every test result, it all has to be documented. That documentation is the official record. It's the proof that the safety net was built correctly, and it ensures that crucial information is passed seamlessly from one team member to the next. So after seeing all of this, all these layers of identification, investigation, communication, and these final checks, it really makes you wonder, doesn't it? Is the real art of surgery just about the technical skill displayed in the operating room? Or is it this entire, complex, and deeply human process that ensures a patient arrives at that table as safely as is humanly possible?